Hello, my name is Dr. Gerald Chodak. Welcome to ProstateVideos.com. In this video, I want to help you get the kind of information that you will need to make a decision about managing your localized prostate cancer. Too often, we find that patients are not getting adequately informed. And for you to get the information you need will require asking certain questions of the physician who's taking care of you. You shouldn't be afraid or reluctant to do that. You have every right to know what to expect. And unless you're adequately informed, you really can't make a decision that will reflect your own goals, your personal health, the kind of tumor you have, and the kind of quality of life you hope to achieve. So let's talk about some of the things to ask. Number one, if a surgeon is talking to you about surgery, you want to know what are the odds that you're going to survive at 5 and 10 years, even longer. You want to know what are the odds that you're going to get each type of complication that can occur. Many men are told that certain complications are possible, but they're never given the odds that they might happen. I consider this like playing blind poker. You're being dealt some cards and asked to make a bet, but you don't really know what your cards are holding. So you don't know how much you're willing to risk. The same is true when you're choosing a treatment for prostate cancer. In order for you to make a good decision, you need to know the odds of getting a good result and the odds of getting a bad result or a complication. To get that information, you're going to have to ask your doctor. Another thing you want to know is, if you're talking to a surgeon, how many of those operations have been done by that doctor. Studies show that those doctors that do less than 20 per year are going to have a greater chance of having complications. If a patient is going to get radiation therapy or seed implantation, you want to know again how many have been treated by the doctor who's taking care of you. It's not very helpful for you to be told about the results from some specialist who works at a major university, because that person may not be the doctor who's going to treat you. So you need the information that's specific for the doctor who's taking care of you. Another important question when you ask the doctor is, how did the doctor get that information? Did they guess the results or estimate the results from the patients they've treated? Or did they use written surveys, which have been shown to give much more reliable information? The bottom line here is, you need and you have every right to expect to get the information needed so you can participate in this decision. This is no longer a case of a doctor choosing your therapy. You have to weigh your risks and benefits, the kind of person you are, in order to end up getting a treatment that is really right for you. And that will require you asking the right questions and then taking that information into consideration so that you can make a decision that fits. Today, more than ever, men need to individualize the treatment that they get. What's right for one individual is not at all necessarily right for another individual. Many factors need to be considered. And increasingly, we're finding that many of the tumors that are diagnosed today don't need immediate treatment. They can be treated more conservatively to see if anything changes. We call that active surveillance. So when you are considering your treatment options, you need to factor in all the risks and benefits of every option open to you, and then consider the type of tumor you have, your age, your health, and the goals you hope to achieve. And with that information, you should be able to choose a treatment that fits, a treatment that will give you the best chance of achieving your goals and acknowledging your concerns. I hope you find this information helpful. Thank you.